Good morning. My name is Yen Nhi, presenting on behalf of University, Vietnam. This case illustrates how delayed screening in a high prevalence setting can lead to severe fetal and maternal consequences, and how to prevent such adverse outcome through screening, diagnosis, and early intervention in countries like Vietnam. Before going into the case, I have no conflicts of interest to disclose, and this case is presented with ethical and educational integrity. To provide some background, alpha-thalassemia is one of the most common inherited hemoglobin disorder worldwide, and in Vietnam, approximately 1 in 7 individuals is a carrier, making this a major public health concern in our countries. In its most severe form, homozygous alpha-0-thalassemia is usually fatal without treatment and is associated with serious maternal and fetal complications, as you can see on the screen. So this patient was a 30-year-old preemie gravida with no known medical comorbidities who presented for routine antenatal care. At her 12 weeks of gestation, the screening showed a low-risk NIPT and a normal nuchal translucency of 1.0 millimeter. However, the hemoglobin neuropathy screening was not performed at that time, and these details become particularly important later as the patient lived in a region with high thalassemia prevalence. The pregnancy progressed uneventfully until 28 weeks of gestation when targeted ultrasound was performed. At that time, the Doppler assessment demonstrated a middle cerebral artery peak systolic velocity of 1.6 mom in terms of interpretation. A value greater than or equal to 1.55 mom missed the diagnostic thresholds for severe fetal anemia. And in addition to the Doppler findings, a detailed structural ultrasound provided further evidence of disease severity. On subjective assessment, the fetal liver appeared enlarged on the transverse abdominal view, occupying nearly the entire abdominal cavity. And on the right picture, you can see that the heart of the fetus was also severely enlarged, occupying almost the entire thoracic cavity. And in addition, the placenta was markedly thickened, measuring 6.04 centimeters, indicating placental megaly. And taken these all together, it represents advanced disease with evolving hydrophytalis and significant hemodynamic compromise. So based on the findings that we have, we did the CBC and molecular testing. The results of both parents showed microcytosis and hyperchromia with the confirmation of homozygous thalassemia due to Southeast Asia deletion. Unfortunately, at that time, due to the late gestational age at diagnosis and the presence of hydrophytalis, management options were very limited. While hematopoietic stem cell transplantation is the only curative treatment, it remains largely inaccessible in Vietnam due to many reasons, such as high cost, limited donor availability, technical complexity, and significant risk. So after multidisciplinary counseling, the parents elected to proceed with the pregnancy termination. So this case represents a missed opportunity for early screening. This led to an important discussion point. What could have been done differently? So in Vietnam, current guidelines recommend initial screening using the single CBC index, particularly MCV and MCH. When the index are low, further evaluation with hemoglobin electrophoresis and genetic sequencing can identify carrier couples early. Ideally, intervention should occur before marriage and before pregnancy. And when both parents are identified as carrier using PGTM before implantation or CVS from week 11 to week 14, we will have further intervention. So from this case, several key teaching points emerge. The first one is alpha-thalassemia major is common, lethal, but preventable. The second is normal first trimester and aploidy screening does not exclude hemoglobinopathies. Third, simple CBC index alone with MCV or MCH can identify most high-risk couples early. And last but not least, early detection enables appropriate counseling and future reproductive planning. So ideally, screening should occur before marriage, before conception, or early in pregnancy. And that is the end of the presentation. Thank you for paying attention.